My name is Lilian, and I'm going to be talking about abortion access and reproductive rights. I think that abortion access and reproductive rights are the most important issue for Texas because they are crucial and they directly impact health, autonomy, and equality. Restricting these rights puts lives at risk, especially for marginalized and low-income individuals who cannot afford out-of-state care. The issue has become urgent due to the recent legal changes like the SB 8 and the overturning of Roe v. Wade, making access to safe, legal abortions a pressing concern. Lack of access perpetuates poverty, limits educational and career opportunities, and it endangers physical and mental health, making it a critical issue for the state. The core challenges surrounding abortion access in Texas are severe and wide-ranging. Restrictive laws such as the SB 8 have created life or death situations for many women. For example, Amanda Zorowski, a Texas woman, was denied an abortion due to the state's strict laws. She developed sepsis and tragically died because she couldn't get the care she needed in time. Her story, reported by the Texas Tribune, highlights the fatal consequences of these abortion restrictions. These laws also force young girls who have been raped to carry pregnancies to term, compounding the trauma they've already experienced. In some cases, the mental and physical damage of forced pregnancies can be lifelong. Additionally, babies born into unstable or abusive households often face neglect, poverty, and significant physical and emotional harm. Furthermore, the lack of access to abortion services, especially in rural and low-income areas, forces women to travel out of state, further delaying essential care and increasing the risk of their health. These problems make it clear that abortion access isn't just a matter of choice, it's a matter of life and death for many women and children in Texas. On the right is a graph showing how, after a Texas abortion ban, the number of legal in-state abortions sharply decreased, and it highlights the barriers women must now face in accessing care within the state. Additionally, a study led by the Johns Hopkins Bloomberg School of Public Health researchers estimates that infant deaths in Texas increased more than expected in the year following the Texas 2021 ban on abortion in early pregnancy. Between 2021 and 2022, infant deaths in Texas rose by 255, a 12% increase compared to a 1.8 rise in the rest of the U.S. The total number of infant deaths in Texas went from 1,985 to 2,240 during this period. To address the challenges of abortion access and reproductive rights in Texas, I would advocate for several key solutions. The first one being policy reforms to support state legislation that protects and expands abortion access. This would include repealing restrictive laws like SB 8 and also enacting new policies that safeguard reproductive healthcare providers and patients from legal penalties. The second one is to increase access to healthcare services, and I would do this by investing in expanding the number of clinics and telehealth options for reproductive health care, especially in rural and underserved areas. This could include funding mobile clinics or offering financial support to existing clinics to increase their capacity. The third one is to launch public health campaigns focused on educating the community about reproductive rights and their available services. This would involve increasing access to comprehensive sex education in schools to ensure that people have accurate information about their rights and options. And the last one being financial support programs. To create state-funded programs to assist low-income individuals in accessing reproductive health care. This could include covering travel expenses, child care, and medical costs for those seeking abortions. Some possible criticism of my solution could be that expanding abortion access in Texas may face strong opposition from political leaders and conservative communities who view abortion as morally or ethically wrong. Additionally, efforts to increase funding for reproductive health care might be met with resistance due to budget constraints or differing priorities, making it difficult to pass new policies. Finally, education campaigns and stigma reduction efforts could be seen as controversial or ineffective in regions where cultural beliefs about abortion are deeply rooted. To respond to the criticism, I would first acknowledge that it is crucial that we protect the individual rights of all Texans. Access to health care is a basic human right, and this includes the right to make decisions about one's own body. When we restrict access to abortion, we undermine the fundamental right. All Texans should have the freedom to make choices about their health without facing barriers or judgment. Secondly, research shows that comprehensive reproductive health care, including access to safe and legal abortion, significantly improves public health outcomes. States with better access to reproductive health care services tend to see lower rates of maternal mortality and higher overall health outcomes for women. Texas has one of the highest maternal mortality rates in the country. Ensuring access to reproductive health care can be a major step towards addressing this crisis and saving lives. To answer Alexander's question of what would it take me to change my decision, it would take evidence of significant harm to public health or safety directly caused by expanded access, credible studies showing increased rates of negative mental health outcomes linked to safe and legal abortions, data proving that current restrictive policies lead to better health, social, or economic outcomes for Texans, and compelling arguments from experts that demonstrate effective alternatives to protect reproductive rights without expanding abortion access.